Hello, my name is Jonas Paludo. I'm an internal medicine resident at Mayo Clinic in Rochester, Minnesota. I'm here at ASH meeting presenting the results of the study entitled Myelomatous Involvement of the Central Nervous System, a Mayo Clinic Experience. So since the introduction of novel agents like bortezomib, lenalidomide, and thalidomide, the overall survival of patients with multiple myeloma has increased significantly. However, the CNS involvement by multiple myeloma incidence has also increased. Out of 4,060 patients with multiple myeloma diagnosed at Mayo Clinic from 1998 until 2012, we were able to identify 26 patients with clear involvement of central nervous system by multiple myeloma. The definition of central nervous system involvement by multiple myeloma that we used was presence of plasma cells in the CSF analysis and/or imaging studies showing evidence of CNS involvement by multiple myeloma. We basically used MRI findings, and we subclassified the MRI findings in leptomeningeal disease, intraparenchymal disease, or direct extension of multiple myeloma. The median age at diagnosis of central nervous system involvement by multiple myeloma was 58 years, ranging from 47 to 80 years old. Most of the patients were diagnosed after 2005, and also all that patients received at least one dose of a novel agent as first line of chemotherapy. 17 out of 22 patients were classified as high risk based on cytogenetic changes. 10 patients were diagnosed as high risk at the time of multiple myeloma diagnosis, and additional 5 patients at the time of CNS diagnosis. The most common initial neurologic symptom presentation was headache, which was seen in 42% of the patients. They're also followed by cranial nerve involvements, visual disturbance, and limb weakness, all seen in 38% of the patients each. 16 patients underwent a lumbar puncture, and 13 out of those patients were found to have plasma cells in the CSF analysis. 25 patients had at least one MRI, and in 80% of those patients, findings suggestive of CNS involvement by multiple myeloma was seen. The most common finding was leptomeningeal enhancement, seen in about 70% of the patients. For the CNS-directed therapy, the majority of the patients underwent radiation therapy. 5 patients also had radiation and intrathecal chemotherapy. 6 patients underwent autologous stem cell transplantation after the CNS diagnosis. The overall survival of patients since multiple myeloma initial diagnosis was 42 months, and the overall survival since CNS diagnosis was only 3.2 months. High-risk cytogenetic features, including deletion of p53, deletion of chromosomal 17, and plasma cell labeling index more or equal than 3%, seem to cluster in this group of patients, and they were associated with a significantly shorter overall survival, 1.3 months versus 19 months. All 6 patients who underwent autologous stem cell transplantation after the CNS diagnosis had a significantly overall survival improvement, median of 19 months. This is likely in part due to patient selection. However, the current data shows that bone marrow transplant could be attempted in patients with CNS myeloma disease. To finalize, it would be important to have a better understanding of penetration of the current and emergent agents in the treatment of multiple myeloma for a better treatment of this specific cohort of patients with multiple myeloma in the central nervous system.